evening and welcome to this edition of Healthcare News Network. I'm Dr. Robert Beck and I will be your host this evening. Join us tonight as we discuss the plague of America, obesity, and what you can do to stop this epidemic. Standing by is Yusra Asim, who will fill us in on just what is obesity. Yusra?
Obesity is a disease which is characterized by the excessive body fat. People who are affected by obesity are usually affected by genetic, behavioral, and environmental factors that are difficult to control with dieting. Obesity increases the likelihood of certain diseases and other health-related problems that can affect your quality of life and reduce your lifespan. It is one of the diseases which is caused by the carelessness of human beings. The topic of obesity is important to the field of sociology because obese people make up a significant portion of world population, and the manner in which obese people are treated has a significant effect, directly and indirectly, on society as a whole. Individuals affected by obesity often face obstacles far beyond health risks. Emotional suffering may be one of the most painful part of obesity. Society often emphasizes the importance of physical appearance. As a result, people who are affected by obesity often face discrimination in the job market, at schools, and in social situations. We are presenting about obesity issue which has become a global discussion point since last decade. We are going to cover what is obesity, how people get obese, and how obese people are emotionally affected, how obesity is affecting US health insurances, and finally, what should be done to reduce obesity. I don't believe that obesity happened due to a disease, but because of bad habit, poor choices, or insufficient nutritional knowledge. Our main objective is to raise an awareness about obesity, its serious consequences on individual and government healthcare system. Finally, guidance on how it can be prevented and controlled.
Obesity is a significant problem in the United States today. It is estimated that 2/3 of Americans are overweight, while 1/2 of those are actually considered to be obese. Southern states are currently leading the pack, with Mississippi leading all states in obesity rates. Colorado is currently considered to be the leanest state in America. However, the recent legalization of marijuana may change those numbers. Obesity has more than doubled since 1980, with over 600 million Americans ages over 18 are considered to be obese. Don't leave the children out of the equation, however, because the World Health Organization has estimated that 42 million children are also obese. As we know, obese children will most likely lead to obese adults. Not only is that a problem, but increased illnesses among children, such as childhood obesity leading to childhood diabetes and other health problems, may play factors in future health scores. Healthcare costs will continue to rise until we can take a look at changes that we can make as the American public. So what exactly is the cause of obesity? Here to shed some light on that for us today is Ihsan Al-Sala. Ihsan?
If you consume a high amount of calories, particularly from fat and sugars, but do not burn off the energy through sufficient exercise or physical activity, that surplus of energy is stored into your body and transforms into fat. Now, you might be wondering how much of calories intake should do the trick. According to WebMD on how many calories should one eat, the average sedentary male between the age of 19 and 51 should consume from anywhere from 2,000 to 2,400 calories, while the average sedentary woman should only consume between 1,600 to 2,000 calories. In consuming more calories than needed, the human body stores this energy into your body for later, storing it into unwanted fat. Now, if you still think eating healthy and exercising regularly is unnecessary, according to World Health Organization, 2.7 million deaths are attributable to diets low on fruits and vegetables. Additionally, 1.9 million deaths are attributable to physical inactivity. Physical inactivity and unhealthy diets are a lethal combination to overweight and obesity. Now, eat well, America, and get active.
But Isan, would you say that there could be a genetic component to obesity?
As you may already know, genes influence every aspect of human psychology, adaptation, and development. Everyone should know additionally that genes also influence obesity in humans. According to University of Laval and many other scholars, of course, genetics play a role in obesity. Researchers have shown that obesity is a complex disease originating from the interactions of various of hereditary and environmental factors. Besides rare cases, many people have genetics predisposition that lead to obesity. Hence, unfortunately, many have weight problems that are just out of their control and cannot be held accountable to a certain degree. We should still not forget my previous point of eating well and remaining active.
Isan, I apologize. I have one more question for you tonight. Does economics play a role in the epidemic of obesity?
According to the US Census of 2009, the number of US residents living in poverty is the largest number in 51 years. Low income families generally have less access to both opportunities in physical activity and healthy food choices. Unfortunately, many neglected communities in rural areas or predominantly inhabited with minorities lack nearby grocery stores that provide fresh produce of quality, green space, parks, and recreation centers. Furthermore, poor families have little opportunities to partake in physical activities because such programs tend to be high. Finally, in an irrational market like ours, where a bottle of water costs more than a bottle of soda, then soda becomes a more economical option for families with lower income.
We now take you live to Sophie Brown, who will discuss the possible solutions to the problem of obesity. Sophie?
The complexity of the obesity epidemic requires the cooperation from everyone at the individual level, organizational level, as well as within communities. Because obesity is mostly preventable, it is important that we develop campaigns that guide people through the process of behavioral change. We also know that environmental factors have a strong influence on behavior, which is why it is equally important that individuals receive continuous support from their social and public surroundings. On an individual level, we want people to learn how to set realistic goals for weight and behavior change. First, we encourage that all that are affected by obesity talk to their doctor about their weight to gain a full understanding of how their weight can impact their overall health. Second, apply the SMART concept of goal setting. The SMART acronym stands for specific, measurable, attainable, realistic, and time-bound. For example, setting a goal to lose 8 pounds in 4 weeks is more realistic than 20. Setting goals where you can achieve results in a short period of time will keep your motivation and willpower strong. Finally, reward yourself after achieving your goal. According to the National Heart, Lung, and Blood Institute, rewards do not have to be expensive, but they should not be food-related. Rewards can be anything that will keep you motivated towards your next mini goal. While personal responsibility is a factor to weight loss, environmental factors also influence our behavior. For too long, our society has had a negative stigma on obesity. Many people suffer from obesity and may internalize the negative stigma against them, which increases low self-esteem and hindered motivation for change. To reduce a negative attitude towards obesity, we need to change the public's perspective. Obesity should be viewed as a disease and not a flaw. In 2013, the American Medical Association officially recognized obesity as a disease. The following year, the Obesity Journal released a national survey of the American public and healthcare professionals that showed a significant shift in perception. The majority surveyed no longer viewed obesity as a result of poor decisions. This latest information should encourage healthcare providers to pay more attention to their patients' weight. Also, Healthcare organizations should make weight loss solutions more accessible and affordable. Childhood obesity is also on the rise. It is important to manage obesity in children because they can grow up to be obese adults. We can start by petitioning for schools to increase physical activity and remove all unhealthy foods such as vending machines or replacing vending machines with healthier options. When it comes to children's health, parents play a key role in promoting diet and exercise. Unfortunately, some parents are not aware their children is at risk of obesity or willing to admit their child's weight is an issue. Therefore, parents need to receive education on the consequences of childhood obesity and the importance of preventing it. Employers have a unique situation in that employees spend a good majority of their day at work. They recognize that healthy employees are happier and more productive. Whether your job is sedentary or active, employers can foster a healthy work environment in many ways. Some examples include free health assessments or biometric screenings, health coaching, subsidized or discounts on fitness facility memberships, or even incentive programs. Implementing wellness programs not only promote a healthier lifestyle at work, but increase productivity and also lowers turnover. Other general recommendations for reducing obesity include making healthier foods more affordable. This can be done by increasing the tax on high-calorie foods that have no nutritional value. We should also limit the advertisement of unhealthy foods, or at the very least ban unhealthy food commercials from children's channels. Lastly, we should increase the access to healthier foods in vulnerable populations by providing free delivery systems or building small markets in rural areas. Regardless of what method we use to tackle obesity, we need to take an empathetic approach. People that are obese know they are obese. Please consider that many people suffering from obesity have tried to lose weight multiple times and have failed. By recognizing obesity as a disease, we can now focus on a legitimate health issue.
Thank you, Sophie. I would like to now take the opportunity to turn the conversation back to Yusra Asam to discuss the recommendations to overcome the epidemic of obesity. Yusra?
Now I'm going to discuss the evaluation and practical recommendation for the virtual audience. Number 1. Feasibility of the proposed solution. State government and counties need to increase their school budget so that schools can afford to buy healthier food, because it is much more expensive than the unhealthy food. Government should intervene and make restrictions on unhealthy food advertisements like they implemented similar restrictions for tobacco-related products. Number 2. Practical recommendation for the virtual audience. The practical recommendation for the virtual audience is that they should give more attention to their surroundings, read newspapers, health-related articles, subscription to the weight loss magazines, and watch informative programs specifically targeted to the reduction in obesity, and finally learn from the other people's experience who were successful in weight reduction. Pay more attention to other people's strength and try to understand what they did to achieve the successful weight reduction. Always pay respect to others and ready to accept criticism positively.
Thank you, Yusra. Tonight we have chosen to delve into the topic of obesity as it plagues our American people, not only among adults but also among our children of this great nation. We've looked at causes of obesity. Is it nature? Is it nurture? Is it genetics? Are there habits? Is it lack of exercise? One may never know the true answer. However, it very well could be a mixture of all of the above. We've given you some solutions, we've given you some recommendations to move forward. But as Smokey the Bear once said, only you can prevent forest fires. And when it comes to the plague of obesity in America, only you can prevent obesity. For Healthcare News Network, I'm Dr. Robert Beck. Good night.